The Quality and Safety Council is a group of 12 nurses, including chair and co-chairs from different unit-based councils. Our main purpose is to promote and create continuous quality improvements and changes based on findings and recommendations from the NDNQI report and themes from incident reports that will positively impact patients' care outcomes. We are involved in many aspects of quality and safety initiatives. This year, we focus on 5 elements which we would like to share with you.
WIQAYA is a patient safety, incident reporting, and risk management system. We have 59 super users who are fully trained and ready to give you the support you need on the day the system comes live on the 19th of October.
Capital equipment such as infusion pumps and monitors are medical devices used in the diagnosis and treatment of patients. Although this equipment helps to improve patient outcomes, they can have serious adverse effects if proper training is not delivered.
The safe use of medical devices is a high priority in preventing harm to patients for use of faulty equipment. To ensure that these equipments are safe for use, a quality control system is set for nurses to report any identified problems with the equipment.
Our nursing education department, in collaboration with Biomed, have developed a structural program of hands-on equipment training and competency check-off for nurses to ensure that they are safe and competent to operate the medical device.
CI Care is an evidence-based acronym that creates a standard process for interactions with patients, families, and colleagues.
C. Connect with the patients or family members using Mr. and Mrs. other preferred name.
I. Introduce yourself, your role.
C. Communicate what you are going to do, how it will affect the patient, and other needs information.
A. Ask for and anticipate patients and family needs, questions, or concerns.
R. Respond to patient and or family questions and requests with immediacy.
E. Exit with courtesy, explaining what will come next when you will return.
Our rounding is part of CI Care. Every hour, a nurse visits the patient to assess their needs based on 6 P's: pain assessment, positioning, possessions, personal environment, pumps, and promise to return. There is evidence to suggest that hourly rounding reduces the number of inpatient falls and call bell use.
Safe practice. It is our responsibility to provide safe and effective nursing care for our patients. Some of the practices that implemented are VTE prevention, safe surgical practice, and safety round tools involve specific nursing measures taken by nurses to deliver best quality care for our patients. In VTE prevention, a standard recommendation risk assessment tool is used to identify patients at risk of VTE. As part of our safe surgical practices, we use the surgical safety checklist model developed by the WHO to improve communication in preventing surgical errors in the operating room. Safety round tools are done every month by the head nurse and members of the UPC. This is to support improvement ahead of the next environmental survey. Nursing Education Department has been conducting a series of education and training sessions to support nurses in the proper use. We are also auditing the compliance to continuously improve this process.
The NDNQI was registered last January 2015. With the NDNQI, we are able to benchmark our indicators, which are pressure ulcer, CLEP-C, VAP, COTI, pain assessment, fall risk assessment, patient restraint, IV infiltration, RM satisfaction, and patient's days and values.
So you will see
That through our hands,
we deliver safe quality care.